Hello and good morning. Welcome everyone to this webinar sponsored by the Maricopa County Department of Public Health and the Arizona Department of Health Services. This is Lori Stillman and I'm the Chief Strategy Officer of Health Resources in Action, a nonprofit national public health organization located in Boston. For those of you who attended our first webinar about an hour ago, I just want to say that I apologize that some of the information that's going to be reviewed over the next few minutes will be a repeat of what was said before, but then a bunch of new information will be forthcoming. Over the past 2 years, we've worked in Arizona with both health departments to help them better understand the opportunities for improving the effectiveness of their public health work. Last year, we supported Maricopa County Department of Public Health Policy Office around promoting healthy work sites. They've already impressively moved our recommendations by establishing the Healthy Arizona Worksites program. Now this year, we're helping Maricopa County Department of Public Health and the Arizona Department of Health Services understand how their health departments can best position themselves for the successful implementation of the Patient Protection and Affordable Care Act in the state, also known as the ACA, and how they can support their partners in this regard. The ACA, as it applies at the local level, will only be successful if a variety of sectors work together with their health departments to leverage their knowledge and resources to create healthier systems of care. To that end, we've produced some in-depth technical reports, special subject fact sheets, and webinar presentations that are tailored specifically for the healthcare, community, education, and workplace sectors, so that they can have a better understanding of how they can join forces to improve population health. By the way, these presentations are focused specifically on the issues related to the provisions of the Affordable Care Act. They are not meant to represent all of the ways that you can work together to promote healthier communities in Arizona. Today and now, we're going to be presenting a webinar that will focus on how the ACA impacts the community sector from a public health point of view. The webinar will be about 30 to 40 minutes long, and then it will leave some time, about 20 minutes at the end, for questions. Just two caveats. The information and recommendations contained in this presentation is an expansive set of opportunities for working together under the ACA. Health departments and their community partners can't possibly tackle them all. The information is meant to stimulate conversations and a planning process where together you can prioritize what opportunities are the most important and realistic to undertake. Secondly, the reports and fact sheets, as well as the recordings of these webinars, will be shared with the public and eventually posted on a web page that the health departments are in the process of creating. They will be providing you with updates on its progress as well as other relevant information as they become available. So let's get going on the webinar. Amy Rosenstein will be the presenter on behalf of Health Resources in Action. And due to the large number of participants, nearly everyone will be on mute, so you'll not be able to communicate verbally with the presenter. However, you can write your questions in the Q&A dashboard on your screen, and we will attempt to answer as many as possible at the end of Amy's presentation. Please don't use the raise your hand function that you'll see on the screen, and this will only tell us that you have questions, but not what the questions are. Use the Q&A dashboard function. Those questions that don't get answered will be forwarded to the health departments, and they'll communicate to you the answers at a later date. Thank you for your participation, and please tell your colleagues about how they can learn more about these topics. And I also wanted to let you know that there will be a survey at the end of Amy's presentation, and after the questions and answers are completed, that we would most appreciate your filling out. So here's Amy.
Good morning. This presentation will cover, we'll start by talking about the impact of the Affordable Care Act and the increased focus on population health and prevention. We'll also talk about opportunities for assessment and planning for health improvement, the importance of health equity. We'll have some discussion about healthy community design, improving access for physical activity and healthy food, and linking resources to community services to public health and healthcare systems. And finally, we'll talk about funding for prevention. One of the most important aspects of the Affordable Care Act is the increase in people who will be enrolled in health insurance. As of January 2014, 1.3 million people in Arizona are expected to gain coverage either through enrolling in Medicaid or in private insurance through the state's exchange. It's not completely known yet how this addition of insured people will affect the healthcare system. There have been some studies of the currently uninsured population which suggest that they may be in poorer health than the currently insured, and that they may have a pent-up need for services. Many of the people who become insured in 2014 will be new users of health insurance, and so they may need assistance in enrolling for coverage, understanding the benefits that are available to them, and the appropriate site of care to use for different services they need. For example, they may be used to getting care in free clinics or in the emergency room instead of with a primary care provider, and so we'll need education to help get used to making this change. There will continue to be a need for safety net providers even after the insurance expansion. Approximately 650,000 people will remain uninsured, which includes undocumented immigrants, people waiting to qualify for benefits, or people whose Medicaid status changes due to changes in their ability to meet eligibility requirements, something that's commonly called churning. Safety net providers will continue to be an important source of care for this population, as well as newly insured patients who have in the past gotten their treatment at community health centers and who would like to remain there as their point of care. People often think that the ACA is just about health insurance, and while that's an important part of it, that's not only what it's about. Its major focus is commonly referred to as the triple aim, which refers to improving the quality of care, containing health care costs, and improving population health outcomes. Population health means improving the health of the entire population, not just focusing on individuals. This requires reducing health inequities among population groups and addressing the factors that impact health, which are referred to as the social determinants of health. These could include the physical environment that people live in, their access to employment opportunities, and educational opportunities. Population health focuses on primary prevention, or preventing illness and injuries from occurring in the first place. And it also focuses on helping people manage their chronic illnesses more effectively. So the focus of the ACA is broad, and to meet these goals, the work of people in multiple sectors will be needed to address the real drivers of health, those factors that are in the community. This focus is a major change for the healthcare system, which will have increased responsibility for good patient health outcomes versus just focusing on the services that they provide. But many healthcare providers are not familiar with population health, with prevention and disease management. They're generally unfamiliar, and two, about how to improve communities themselves as a way to improve the population, to improve patient health. One of the important ways that the ACA supports population health and primary prevention was the establishment of the National Prevention Council, which in turn developed the National Prevention Strategy. The National Prevention Strategy is basically the national blueprint of principles and strategies for improving health in the communities where people work, live, learn, and play. The National Prevention Strategy outlines 4 key strategic directions: building healthy and safe community environments, expanding quality preventive services in healthcare and community settings, empowering people to make healthy choices, and eliminating health disparities, which means the differences in incidence, mortality, and burden of diseases and other negative health conditions that impact specific groups of people. While people often think about the importance of eliminating disparities, an equally important focus is promoting health equity, which means working at the community level to address unfair distribution of resources in communities that can lead to poor health. So that's an important theme that runs throughout this prevention work. The National Prevention Strategy includes 7 priorities, which are focuses throughout the strategy, the directions that they outline, and are highly aligned with the work of the health department. These 7 priority areas are tobacco-free living, preventing drug abuse and excessive alcohol use, healthy eating, active living, injury and violence-free living, reproductive and sexual health, and mental and emotional well-being. The ACA established the Prevention and Public Health Fund as part of redirecting health systems toward prevention and strengthening the capacity of the public health system. The Prevention Fund's purpose is to improve health and help restrain the rate of growth in private and public sector healthcare costs. The Prevention and Public Health Fund was funded by the ACA originally to direct $10 billion through 2020 toward prevention-oriented activities. This was the only federal budget item dedicated specifically to prevention and public health. In recent years, the Prevention and Public Health Fund has been jeopardized, though, because of the various budget cuts and because of political disagreements about its value. So it remains a very important source of funding for prevention, and it's very important that it's protected. The Prevention and Public Health Fund main initiative is a Community Transformation Grant program. Community Transformation Grants aim to make measurable differences in chronic disease incidence and outcomes by supporting multi-sector collaboratives that implement new policies and systems changes to support healthy community environments. The program began in 2011 and is expected to run for 5 years. Just to give you a sense of the scope of funding, in 2011 and 12, together $177 million were awarded in community transformation grants to states, community-based organizations, and others. In contrast to other public health grants that focus on single programs or single interventions, the community transformation grants focus on policies and systems that aim to change the environment with the goal of having a long-term sustained impact on health status. So they're very large, ongoing, and sustainable initiatives that are the focus. Community transformation grants can be awarded to collaboratives that include government agencies, community-based organizations, and others. And typically, most of them have multiple partners participating. The ACA also supports the focus on population health planning. The ACA requires that tax-exempt hospitals conduct community health needs assessments with stakeholders at least every 3 years, and that they use the results to develop community benefit plans to address the areas of need that were identified as part of the assessment. The IRS also imposes requirements on that tax-exempt hospitals use their community benefit expenditures to align with the community health needs throughout this process. Up until now, typically hospitals may have used much of the community benefit dollars to write off bad debt for the uninsured. So this is a significant change and an important opportunity for hospitals to really focus on public health and health promotion. Health departments are required to do a community health assessment every 5 years as part of their accreditation process. So by aligning their community health assessments with those of the hospital cycle, there's the potential to have a very big impact in this area. And we'll talk a little bit more about that later in this presentation. Community prevention efforts will have the greatest impact if health departments and hospital community health improvement strategies use evidence-based methods or methods that research have shown to have positive outcomes to address the key social and economic determinants of health. A very good source of information on prevention is the CDC's Guide to Community Prevention. This guide has been in existence since 2001, but it's now funded by the Prevention and Public Health Fund to accelerate evidence base on systems changes that can have an impact on chronic disease risk factors and outcomes. This is a very important document and one that's really useful to educate the partners that you work with about the valuable resources that can be found there. As I described earlier, community transformation grants are a good platform to bring together partners to address things like reducing exposure to tobacco, preventing avoidable injuries, promoting healthy eating and active living, and working toward healthy community design, which is something we'll talk a little bit more about later. These grants provide an opportunity to tap partnerships with agencies in different sectors for a stronger collective impact to promote policies and environmental strategies which support equitable, healthy communities. Organizations involved in community planning, safety, education, and transportation are natural partners to pursue. The National Prevention Council advocates for health in all policies approach, which encourages all sectors to consider the health implications of their projects and plans. At the federal level, health agencies are working with other agencies and sectors whose missions are not explicitly health-related, but still have the potential to have an impact on health outcomes. And this approach is also being implemented in many efforts by MCDPH and ADHS at the state and county levels. Health impact assessments are an important methodology for promoting health in all policies. Health impact assessments basically enable decision makers to consider the health impacts of new plans and projects on community members, especially as they affect vulnerable communities. They examine the opportunities, risks, and impacts of planning or investment decisions on community health and health equity, and offer recommendations that will help promote positive health outcomes and minimizing negative ones. They can be used proactively to address land use, transportation, housing, and economic development plans and projects to make sure that they don't lead to health inequities where significant burdens are experienced by particular population groups. Arizona is already actively using health impact assessments with 2 currently underway and many communities having expressed interest in conducting them. And the biggest issue is expanding the capacity to undertake these assessments. Low-income and minority communities have the highest rate of chronic diseases, injuries, and other negative conditions, and studies show that access to medical care represents only a small percentage of what ultimately shapes a community's health status. Social and economic factors like access to quality education, employment, and housing, as well as healthy foods and recreational opportunities, are key determinants of health disparities. And health disparities are an issue in Arizona. Here are a few facts from the Maricopa County 2010 Health Status Report. In 2009, the lowest rank in overall health status in Arizona was the African American community, followed by American Indians and Hispanics. African Americans have the highest mortality rate due to heart disease, stroke, and cancer, and American Indians have the highest mortality rate from diabetes, around 6 times higher than the rate for all other Arizona residents. Health departments can take a lead role in addressing these disparities by analyzing data, identifying community resources, and understanding health outcomes for different populations and highlighting inequities when they occur. But the key next step is working with other community-based organizations to target resources to support vulnerable populations in neighborhoods where there's poor access. And it's important to work with Arizona's REACH program and ADHS Disparity Center, which both have a number of very valuable resources and tools to support this kind of effort. Obesity and heart disease, which heavily impact Arizona like the rest of the country, are linked to unhealthy lifestyles. And community health design is planning and designing communities to make it easier for people to live in a healthy way. Healthy community design links destinations that promote health, like schools, parks, grocery stores, and workplaces, with a transportation network that facilitates safe travel for pedestrians, cyclists, public transportation users, and car drivers. Healthy community design can influence the overall health of a community by making healthy lifestyle choices easily available and accessible to everybody in the community. There are evidence-based policies and practices that are shown to have a positive impact on communities. Some of these, which you can find in the CDC Community Prevention Guide, are increasing proximity of residential areas to stores, jobs, schools, and recreation areas, improving sidewalks and streets, and enhancing other safety aspects of the environment. And health impact assessments are an important tool because they can ensure that community development plans don't perpetuate unhealthy conditions that communities have dealt with historically. An example of some healthy community design work is an initiative that was undertaken by the Los Angeles County Department of Public Health. They chose to influence land use policies by supporting cities and community organizations to develop policies promoting healthy eating and active living, like plans for safe streets, transit-oriented districts, and greenways. They worked with the cities within the county to develop comprehensive plans that consider how appropriate development can improve health and reduce health disparities. One city with a large Hispanic population and a growing obesity trend developed a strategy in its general plan to address the city's lack of safe facilities and parks where residents can be physically active. And they developed a 1-mile fitness circuit in a local park, which is now being replicated in other parts in the area. There are some good examples, too, of healthy community design that's being used in Arizona. The Livable Communities Coalition brings together a range of organizations to provide input on general plans in Phoenix, Tempe, Mesa, and Scottsdale. And ADHS's Children and Youth with Special Healthcare Needs Health Policy Council works to ensure that all policymaking around community design meets the needs of special needs populations, thereby eliminating the need for separate special standards to be developed. Related to this are efforts to improve access to physical activity. Safety and violence are a very important issue for many communities as they work towards healthy community design. In many cases, parents don't want kids to play outside in their neighborhoods, and many people are afraid to walk in their communities because of concern about violence and safety. So this is also a very important aspect of community design to consider. There are a number of evidence-based street design policies that can improve physical activity, like improving street lighting, promoting safe pedestrian crossings, and using traffic calming approaches. Complete streets policies are being developed in many cities to create environments that are conducive to physical activity. These policies formalize a community's intent to plan and maintain streets that are safe for users of all ages and abilities, and that can accommodate pedestrians, cyclists, public transit users, motorists, and freight vehicles. There's currently an effort to develop a complete street policy in Phoenix, and this approach can be expanded to other communities, probably building off of efforts that take place in Phoenix. Schools are also key partners for improving opportunities for physical activity, and have been so in Maricopa County. One type of policy that school systems can adopt are strategies encouraging students to walk more. MCDPH's Safe Routes to School programs is a successful effort that could be expanded to other destinations like parks, healthcare sites, and shopping areas. The community schools model, which is another model that's being incorporated in many school systems, integrates an array of community services and resources into the school setting and can support many aspects of healthy community work. And one way of formalizing this is through joint use agreements. These agreements increase opportunities for people in the community to be more physically active by enabling schools, the city, and private organizations to share indoor and outdoor spaces like gyms, athletic fields, and playgrounds. Maricopa is currently looking into joint use agreements, and this can be looked at in other counties as well. And there's lots of information available about these online, like at www.jointuse.org. Another important area of focus are efforts to improve access to healthy food. As you all know, obesity is a leading cause of chronic disease and a major source of focus for a lot of funding opportunities. Arizona is currently taking an active approach to supporting healthy eating, and there's a lot of different models that could be pursued. One approach is the use of healthy vending programs, which ensure that healthy snack and beverage options, which meet specific nutritional standards, are available in vending machines. It's important that these options are set at reasonable prices, making them accessible to everyone. The health departments have already established healthy vending programs in county buildings and are working on expanding these programs to schools, community organizations, the park system, and other counties. There's a lot of work across the country to implement healthy vending policies that can be looked at as examples. Recently, the National Park Service began introducing new food standards that will require national parks across the country to offer healthy food options to visitors. Many states have implemented healthy vending policies in parks, schools, and workplaces. For example, the city of Chicago launched a healthy vending challenge to businesses and organizations, and several healthcare organizations were among the first to commit. And this leads me to the point that partnering with hospitals and healthcare organizations along with other early adopters can be a logical step in terms of expanding healthy vending programs. As organizations in Arizona explore options for bringing healthy food to communities with limited access, there are plenty of examples across the country to learn from. The establishment of ordinances for and promoting farmers markets can be a very important vehicle for expanding food access. But food at farmers markets can also be relatively expensive. So to address this, King County, Washington ensured that low-income residents could use their SNAP and WIC vouchers to purchase food at farmers markets. This approach is being taken by other communities, and some others are making communities available to help making coupons available to help make prices more reasonable. Another approach is working with stores to provide healthy food options. For example, the Big Cities Health Coalition's work to impact grocery store advertising and food display practices is one that could be looked at. King County enlisted businesses to participate in Healthy Foods Here, a program to increase access to healthy food options through small corner stores and convenience stores. San Diego County used their Community Putting Prevention to Work grant to establish community gardens by removing zoning restrictions, as well as creating a stakeholder group to ensure physical activity and nutrition are incorporated into all aspects of public planning. And Texas established several food access initiatives through its community transformation grant, such as establishing farmers market and farm stand programs in underserved areas, establishing a community gardens initiative, including one at a local food bank, and developing a healthy restaurant coalition. Those are just a few examples of the many efforts going on across the country that you can look at for promising practices. An important concept in healthcare delivery in recent years has been the development of the medical home model, which is basically a primary care model that's team-based and focuses on coordinated care that's comprehensive and patient-centered, meaning focused on putting the patient's needs first and foremost within the context of the care being delivered. The concept of the community-centered health home broadens this to collaborate with community organizations to address issues in the broader environment that impact population health. This approach begins with healthcare organizations collaborating with community groups to use data to understand social, economic, and community conditions that affect health. Health system and community partners then work together to identify solutions and to advocate to influence policies, such as implementing new street cross markings in areas with repeated pedestrian injuries, or smoke-free housing policies in housing development where many patients are hospitalized, have preventable hospitalizations for asthma. One example of a community-centered health home is the Akron Accountable Care Community in Akron, Ohio. That community has a high prevalence of type 2 diabetes, and the Accountable Care Community, or the ACC, brought together a range of organizations including healthcare providers, employers, the Chamber of Commerce, universities, transportation groups, and more to come up with solutions. In addition to planning some healthcare interventions, they also had an important focus on changes they could make in the environment. So to do this, for example, they expanded the concept of the public lands for public health with a nearby national park, basically making public transportation more to make the park more accessible. They conducted a health impact assessment on the Akron Marathon and developed partnerships with faith-based community groups for health education and screening for underserved individuals, and collaborated with the Metropolitan Transportation System to improve transportation and to provide increased opportunities for physical activity and healthy, affordable food. That model is a model that's gone quite far in their efforts, and a good one to take a look at for more information. And as always, funding is very important to focus on. While the ACA puts so much focus on prevention and population health, public health only gets 3% of the healthcare funding. And with the ACA's focus on funding healthcare access and reorganization, it's very possible that public health prevention initiatives can end up getting short-ended in their funding to support those efforts. If we're really going to make the case to move toward the triple aim goal of improving population health and preventing illness, there needs to be more resources to strengthen and protect public health functions, and community organizations can have a very strong voice in advocating for public health funding to promote healthy communities. One such effort that you can look at was undertaken in Massachusetts, where public health organizations, healthcare providers, faith-based advocates, community-based organizations, and business leaders successfully came together to call for the creation of a new prevention and wellness cost control trust fund as part of the healthcare payment reform law. The funds, as part of this trust fund, are being used for programs to stem chronic illnesses like diabetes, asthma, and heart disease, which are such major drivers of healthcare costs. The Mass Public Health Association took leadership with the coalition to make the case for the return on investment and really showing the impact of how this prevention effort has worked. More information about that effort can be obtained by looking at the Mass Public Health Association website. So just a few closing thoughts. Arizona has a very strong base of primary prevention activities, and collaboration across the sector is taking place already. It's a good time to take advantage of opportunities to learn from other states about effective strategies, especially looking at some of the different pilot initiatives that are currently being funded through some of the federal funding opportunities. It's always very important to communicate about the social and economic value of community prevention. And as part of this, you always want to be able to demonstrate the return on investment for prevention activities. It's important to pursue funding opportunities now to support healthy communities, healthy eating, and active living, working with the many organizations in different sectors that can impact health.
Thank you, Amy. We appreciate everybody participating. If you have any questions, there are none that have come in through the Q&A dashboard. We'll give you 1 minute to please enter your questions. If there are none, we'll have some information for you following in just about 60 seconds. So hold on. Okay, it doesn't look like there are any questions that have come in. We had a number of questions that came in our last webinar, and I believe that they were probably very applicable to today's webinar. So we will conclude now, but before we do, a couple of things. One is when you close down, you will see a survey, and we encourage you to please fill it out very briefly. And then secondly, tomorrow at 9:30, there will be 2 more webinars, one for geared towards the education sector, and then at 11 a.m. another one on the workplace sector. And we'll have more information for you about how the Affordable Care Act impacts those sectors from a public health point of view. I will say one other thing. There is a question that just came in. Brittany, do you want to read it?
Sure. The question is, what requirements does the ACA have regarding public health departments?
There's a question about what the ACA, how it affects, or whether there are any requirements for public health departments in particular. As far as I know, there are no specific requirements for public health departments. There are a lot of implied roles for public health departments, for sure. For instance, the fact that hospitals, nonprofit hospitals, are required now every 3 years to conduct a community health needs assessment and health improvement plan, that does require public health expertise at the table. But that doesn't have to be a public health department. There are other things that imply a public health role. For instance, the healthcare sector, for instance, is supposed to be keeping data on health disparities, for instance. And that's something that often health departments are keeping track of or collecting. But there are no requirements, as far as we know, of health departments related to the Affordable Care Act.
So there was another question that just came in, and it's regarding whether the ACA will be replacing the Ryan White for HIV-positive individuals, and could we confirm that or not?
So we don't have the answer to that particular question right off the bat, but as I mentioned in my introductions, we will be collecting all of the questions, forwarding them to the health department, and then they will develop a frequently asked questions fact sheet or some other way of communicating the answers to your questions. And they are developing a web page that will contain this webinar as well as other fact sheets that we have developed for the health departments that people can access. It looks like somebody else answered this question about Ryan White, which is it says that Ryan White will continue for the foreseeable future. And we do know that HIV/AIDS issues are certainly in the President's budget. So we're assuming that HIV services will continue as well. So that concludes this presentation. Thank you very much for joining us. And we hope you'll join us for tomorrow's webinars at 9:30 and 11 a.m. on the education and worksite sectors. And thank you for participating. And please fill out the surveys. Take care then. Bye-bye.